have to set your timer. Sanjay Sarma is going to talk about how do we treat patients like a valued customer. And when I saw that question posed, I immediately thought that it relates to patient empowerment a lot. And I also remembered meeting Future of Health Technology Summit in 1998 when we discussed patient-physician communication. And we invited Ritz-Carlton quality manager to talk about how to treat patient like a king or a queen. And I'm glad we continue that topic today. Sanjay Sarma is co-founder of Prosperata, a new vibrant company focusing on that area. He's entrepreneur and thought leader in health technology. His passion lies in using advanced analytics to transform the patient experience from transactional to relationship-based. Sanjay has worked on some of the most cutting-edge projects in healthcare and has the ability to analyze complex product and market dynamics to provide valuable insights that impact patient experience and healthcare outcomes. Sanjay has previously worked for Deloitte Health, IBM Advanced Analytics, and Allscripts. He holds Masters in Public Health from University of Illinois, and I call Sanjay and his partner, co-founder Rahul, a dynamic duo. Because of companies like that, we can make progress. So good luck with your company, and we can't wait to hear about your ideas.
Thank you, Renata, for that wonderful introduction. We're here to talk about treating patients as valued customers. And first, I'd like to invoke you. Friends, Americans, global citizens, we are here today because we deserve a new healthcare system that treats patients like valued customers, just like we expect in other industries. And I'm also here today to share with you a personal story. I struggle with multiple conditions that have become chronic over time, that were underdiagnosed, misdiagnosed, and even when I did discover them, I found that the healthcare system was difficult to deal with. Everything from discharge instructions, to the lack of clarity around bills, to the poor customer service, made me suffer. And so we started this company, Prosperata, to help healthcare organizations with the mission to collaborate, innovate, and prosper. So let me start with my vision for what it means to treat a patient like a valued customer. First of all, it is a fundamental transformation away from episodic reactive care to a highly advanced system that leverages new data sets that haven't been used before, such as genetic, psychobehavioral, social, clinical, and environmental data through the use of advanced analysis, predictive algorithmic applications, and artificial intelligence. Then, we need the support of the healthcare payer and healthcare provider industry. We need their leadership and collaboration. And when we have that, we will create a new system that predicts and prevents disease while providing necessary care. Of course, medical care will never go away, but the focus will be on prediction and prevention. And we'll do that by empowering patients and consumers with new experiences that motivate them and inspire dynamic collaboration across payers and providers and across the healthcare ecosystem. Of course, to do this is no simple task. And to transform the customer experience, we need the support of the entire healthcare ecosystem. And this includes patients and consumers, providers and payers, as well as technology vendors and policymakers. And when we have that support, we will see a dramatic improvement in health outcomes that is both equitable and affordable. So where are we today? Well, today, healthcare is still mired in transactions and treating us as just like patients. Doctors, hospitals, and health insurers are paid just for treating symptoms and sickness, not for treating us like customers, let alone valued customers. So the next question is, well, then what's the difference between a patient and a customer? Well, I looked at a variety of different definitions, and the one that stuck out to me the most, the one that inspired me the most, was this, by a great man, Mahatma Gandhi, who once said, "A customer is the most important visitor on our premises. He is not dependent on us, we are dependent on him. He is not an interruption of our work, he is the purpose of it. He is not an outsider of our business, he is part of it. We are not doing him a favor by serving him. He is doing us a favor by giving us the opportunity to do so." And this is the basis for our inspiration this morning. So what can we learn from other industries? Well, we know that industries such as retail, financial services, and entertainment have gone a long way to transform the customer experience already. Financial services firms, for example, now have financial planners who help consumers based on their preferences and needs with a variety of different things, including loans, insurance, wills, etc. Companies such as Amazon are already famous for their ability to use our product histories to make recommendations, product detail information, and now they're even into the delivery process. They do one-click ordering and same-day delivery, and have pretty much displaced UPS and the Postal Service for most of these things. Entertainment companies like Disney, of course, are already famous for their cartoons and feature films, but they've gone now beyond that and extended beyond that and captured additional aspects of the customer journey and are now into theme parks, hotels, and resorts. So why is it that healthcare can't learn from all these other industries? Why is it that healthcare is always the last one to adopt new technology and to learn from these great minds that have succeeded in other industries? Well, the answer is that healthcare today is unlike any other industry in America. Healthcare is triangulated in incentives. For the majority of Americans, over 60%, healthcare is paid for through their employer, so they don't feel the cost of healthcare. When they go to the doctor or the hospital, the doctors and hospitals view not the patient as the customer, but actually the health insurer, who they submit claims to and who pay their claims. So what about the health insurer? Since we pay premiums as consumers, shouldn't they view us as the customers? Would seem to make sense, but it's not the case today. Why? Because the majority of dollars that health insurers make are through employer groups. So they view employer groups and HR groups as their primary customers. Think about it, health insurance is the only business that we pay for our services, and then we have to ask permission for what's covered and what's not. At the end of the day, this triangulation puts patients in a difficult position and is frankly undemocratic. So the good news is that the Affordable Care Act does make reasonable attempts to address this triangulation. The ACA, of course, contains the controversial mandates around purchasing a health plan and established a state-based marketplace for insurance purchasing. Not only that, it has new models around accountable care, which are providing financial incentives for both providers and payers to keep patients healthy. In some of these value-based models, providers are being reimbursed based on specific process and outcome measures. So these are all steps in the right direction. On top of that, we now have the HCAP survey, which is focused on patient satisfaction. It's the first national standardized publicly available survey on patients' perspectives in their care. Measures things such as experience with a physician, experience with nurses, experience with staff, and a variety of other things. Today, CMS is actually reimbursing providers for their results and their HCAP scores. Additionally, health plans now are also being measured on patient satisfaction. So just recently, for the Medicare star ratings, they have added a component around patient satisfaction. Not only that, they've eliminated financial bonus for health plans that do not achieve a 4 or a 5 rating. So what's the results on all these new efforts? Well, the transition hasn't been easy. The transition toward value is complex. We've seen that some of the results have been good. Some of these accountable care organizations have succeeded, while others have not. Some of them have dropped out. Some of them have lost money. And what we're finding is that broad adoption towards value and towards a customer focus is going to take much more than simply incentive structures, payments, and penalties. The tough part, of course, is getting everyone together to collaborate and work together. And as we can see, today consumers are dissatisfied. About 25% of patients are considering or have already switched their health plan or doctor recently. So again, what is it going to take to make this happen? We need two major things. We need patients and consumers to be empowered and engaged, and we need providers and payers to work collaboratively together. So now let's think about this a little more in depth. So let's talk about, what do patients and consumers want? What are they asking for? Well, they're asking for the same things that we expect in other industries. They want things like concierge health, membership and technology services, and the same experiences through the internet and through telehealth, telemedicine, and mobile applications. When we go even further and we look at what is this idea of the patient experience all about, we have a model at Prosperata, which is the 5 C's of patient experience, which are clarity, convenience, compassion, customization, and carrots. Let's go through each of these one by one. First, clarity. Patients and consumers are demanding better clarity in their communication from their providers and payers. I think about how many times I've been to the doctor and the doctor gave me some instructions and it didn't follow up at all. I didn't really understand what those discharge instructions were at all. Maybe it was on a piece of paper, maybe it was said through word of mouth, and at the time I wasn't well. So how could I possibly understand what my discharge instructions were when I wasn't well? Things like medical bills. Things like medical bills are, sometimes they're on time, sometimes they're late. Sometimes I just receive a notice in the mail a month later that it's already past due. So obviously these things need to be fixed, and medical education as well is an area that needs to be improved as well too. Convenience. Patients and consumers want healthcare to be easy. It's simple. They want simple and clear explanation of bills. They want the ability to do things. They want to be met where they are today. They want to be able to schedule appointments digitally and refill prescriptions. They want the ability to have multi-channel communications. There are segments of the population that respond better to the phone. There's others that respond better to text messages. And organizations need to be aware of that. Compassion. Think about this. 41% of US citizens in a recent study believe that healthcare is more concerned about money than people. We have a crisis. We need to show compassion for patients in their situations in order to engage them better in their health. And showing compassion is not just about providing those pleasant experiences, but it also impacts how we treat them and design interventions outside of the care setting as well. Customization. Of course, a very broad term, but what we mean is that we treat patients and consumers based on their individual situations. When we look at the determinants of health behavior, these include genetic, environmental, and behavioral insights. So in the future, what if we have applications that can view the genetic profile of an individual and provide medical education specific to that patient? Or perhaps we can scan their environment and see where they're located or where they're going, and give them an indication that they're susceptible to a disease or some condition at a certain place that they are. Or perhaps we can look at their behavior and make recommendations that will help them improve their health. Finally, carrots. Of course, couldn't think of another word for motivation, but carrots is about using tools and encouraging healthy behaviors. And what we're seeing is that this is starting to happen. Employee wellness programs are a great example of that. And organizations are encouraging people through competitions, through financial incentives, to stay healthy. And so this is an important aspect of how we're going to be able to change behavior. So when we do all this, when we focus on the patient experience and put patients and members first, what we'll see is that patients will become empowered. And patient empowerment is about participating in that healthcare decision. And what we can see is that when they do so, they're more likely to recover from illness. And there's data to support this. Recent studies by the British Medical Journal have showed the link between patient experience and improved adherence to protocols and outcomes. Other studies have done the same with diabetes and coronary artery disease. Shared decision-making is also a part of patient empowerment. And especially when we move towards new payment models, these new complex payment models, it'll be important for consumers to understand how to share in the decision-making. When we look at things like quality over cost and very complex ideas that are going to be presented to patients, it's going to be important that they share in this process. And if we start to engage them now, it will go a long way to making these future payment models work. So how do we empower patients, and how do we improve the experience? Well, health applications, of course, are a very important part of that. And health applications, in a lot of ways, are at the center of the patient-centered approach. So there are a lot of interesting applications out there that are popular and downloaded, things like calorie counters, iTriage, ZocDoc. But most of those applications aren't actually built by healthcare organizations. They're built by disruptive companies. And what we're finding is that health systems have not done a great job of designing health applications. So as we assist healthcare organizations in developing applications, there are a few things they need to keep in mind. First, they need to be personalized. They need to be designed based on who they're trying to target. Obviously, an application for a group of pregnant teens should be designed differently than an application for athletes. Less is more. Applications shouldn't be too busy. They need to stick with a few features and make those features rich. Dynamic. They need to have content refreshed at all times so that patients and consumers enjoy the applications and enjoy using them. They need to have a mobile hook. They need to have one feature on that application that makes that application indispensable for the consumer and the patient. Finally, the obvious one, they need to be easy to navigate. We don't want to confuse patients with annoying screens and bothersome ads and make them disengaged because of that. So one example of and there's a lot of other great applications these days. One example is Health Companion. They use a social network model to try to connect patients with others who are sharing their condition. They also allow you to download information on your insurance claims. So they do a variety of interesting things. Another one, Patients Know Best. It's actually based in the UK, and they allow secure control over your medical records. And not only that, you're able to actually share that view directly with providers and healthcare professionals. They also do things like online consultations. They have appointment scheduling and reminders, and a variety of other features that are to the consumer benefit. So now that we understand what it's going to take to empower patients and consumers, let's think about what the industry then has to do. Healthcare payers have their work cut out for them. And it's because patients and consumers, like myself, are starting to ask whether health insurance is even worth it. I myself spend over $1,000 a month between myself and my wife for health insurance, and there are still things that aren't covered. I'm not sure what's covered and not covered. Not only that, premiums and copays are rising rapidly in the order of 7 to 9, 10% a year. So health insurance companies need to start customizing their products based on the health and financial situations of their populations. Not only that, they need things like lookup tools, the ability to view cost and benefit information clearly. And we're starting to see some innovations happening. There are now applications that can help consumers with their financial responsibility. When you try to schedule an appointment, there's a tool now that can run an EDI transaction to your health insurance company, get your benefit coverage levels, and then run that against the provider charge master to then provide you exactly what your financial responsibility is going to be up front. So these types of applications are the wave of the future. How about healthcare providers? Well, they also have a lot to do as well. And of course, healthcare providers are responsible ultimately for what's most important, the quality and safety of healthcare. So a couple things they need to do are to standardize routine care and to coordinate complex care. And care coordination involves the use of care teams. And when we have these care teams, we will see that they will impact the customer experience significantly by assisting with follow-ups, by identifying and overcoming barriers to adoption and engagement, to providing benefit management support, and to helping to navigate providers. And we'll see that when we have effective care teams, care gaps will be closed and good health outcomes will be achieved. Providers also need to use data effectively. It's obvious. And while there's a lot of hype around big data, the truth is that 90% of providers can't even answer basic questions like, how much does my average diabetes patient cost? They're still struggling with basic clinical, demographic, financial records, logs of all calls and emails, and unifying the experience for the patient. So only when we overcome these basic barriers can we then move on to more complex sources of data. So what's the role of technology? Well, technology, there are a number of different technologies that are important, but application programming interfaces are very important in healthcare. They are the key to unlocking the data. With APIs, patients can have access to their own information, and providers can get things such as clinical information on dosages and clinical protocols. So finally, what is the call to action? The time to act is now, and the opportunity has never been greater. Providers and payers need to open up data and share data between applications and collaborate better. Technology companies and policymakers must leverage open APIs and must create the right incentive structures. Patients and consumers, of course, must demand to be empowered and to use data to take charge of their own health. So when we look back 20 to 30 years from now, we will see that we have created a highly advanced health and wellness system that treats patients like valued customers and is truly an example for the rest of the world. Finally, how we help. Prosperata helps healthcare organizations with patient experience and information management solutions. We are a passionate, multidisciplinary team at the cutting edge of healthcare technology and policy, and we want to drive system-wide collaboration towards the end goal of treating patients as valued customers. We look forward to working with all of you to make this vision a reality and to transform healthcare. Thank you.